In this video, I will cover some of the hormones of the reproductive system. Let's begin with the hypothalamus and pituitary gland. Gonadotropin-releasing hormone is secreted by the hypothalamus and works to regulate secretions of both follicle-stimulating hormone, FSH, and luteinizing hormone, LH, which are secreted by the anterior portion of the pituitary gland. These hormones are common to both males and females, but have different effects. In males, FSH is primarily responsible for stimulating the development of sperm cells in the testes. It also helps to regulate the production of testosterone. LH plays a key role in regulating the production of testosterone by the Leydig cells in the testes. Testosterone is the primary male sex hormone produced by the testes. It plays a crucial role in the development and maintenance of male reproductive tissues and secondary sexual characteristics. These include development of the male reproductive organs, sperm production. Testosterone stimulates the production of sperm in the testes through its interaction with follicle-stimulating hormone, FSH. Secondary sex characteristics. Testosterone is responsible for the development of the male secondary sexual characteristics, including deepening of the voice, growth of facial and body hair, and increased muscle mass and bone density. Libido and sexual function. Testosterone plays a critical role in male sexual function and libido. It increases the production of nitric oxide, which is necessary for erectile function, and also influences sexual desire and arousal. Mood and cognitive function. Testosterone has been shown to have an impact on mood and cognitive function. Low levels of testosterone have been linked to an increase of depression, irritability, and fatigue. Metabolic health. Testosterone plays a role in the regulation of metabolism and body composition. It promotes muscle growth and reduces fat, which can improve insulin sensitivity and reduce the risk of obesity and metabolic disorders. In females, FSH stimulates the growth and development of ovarian follicles and stimulates the cells surrounding the immature oocytes to produce estrogen, which helps to prepare the uterus for pregnancy. As the follicles grow, they produce increasing amounts of estrogen, which in turn triggers a surge of LH that causes ovulation, the release of a mature egg from the ovary. LH also plays an important role in regulating the menstrual cycle in females. After the surge of LH triggers ovulation, the ruptured follicle in the ovary forms the corpus luteum, which produces progesterone, a hormone that prepares the uterus for implantation of a fertilized egg. If fertilization does not occur, the corpus luteum breaks down, progesterone levels decrease, and the lining of the uterus is shed during menstruation. Estrogens are a group of hormones produced primarily by the ovaries in females. Some of the main functions of estrogen include development of female reproductive organs, menstrual cycle regulation. Estrogen plays a key role in regulating the menstrual cycle. It stimulates the growth of the endometrium, the lining of the uterus, in preparation for pregnancy. Development of secondary sexual characteristics at puberty. Bone health. Estrogen plays an important role in maintaining bone health. It helps to regulate bone turnover, and low levels of estrogen are a major risk factor for osteoporosis. Cardiovascular health. Estrogen has a protective effect on the cardiovascular system. It helps to maintain healthy blood vessel function, and low levels of estrogen have been associated with an increased risk of heart disease. Brain function. Estrogen has been shown to have a range of effects on brain function, including improving memory and cognitive function, reducing symptoms of anxiety and depression, and promoting neuroplasticity. This concludes this video on reproductive hormones. Thanks for watching, and see you next time.